and the immense responsibility of adjudicating in an era marked by radical change.
South Africa is experiencing rising rates of obesity among both adults and children. Nearly half of adults are affected, and childhood obesity has increased from 1 in 20 to 1 in 8 over the past decade. Health experts warn that if the trend continues, over 4 million children could be living with obesity by 2031. To discuss the role of ultra-processed foods and marketing practices in this health crisis, we're joined by Nzama Mbalati, who is the CEO of the Healthy Living Alliance, and he joins us virtually from Johannesburg this evening. Nzama, thank you so much for your time. This is not a new conversation. The warning signs have been there. They are now red flags, and your organization is calling it a crisis. Why are we still having to have this conversation, and why are those who are in positions where they can make a difference not treating it as a crisis?
Thank you so much for having us. That's a very critical question. If we're calling or we are having a crisis, we expect emergency kind of interventions to address the problem. So two things that are actually holding us back. First, the decision and policymakers do have intention. So one of the things that we know government has done in terms of implementing low-cost intervention, to promote healthier diets and actually to minimize exposure of adults and children to unhealthy food has been the health promotion levy. There is the front of pack warning labels on unhealthy food, proposed regulation. That is again delayed, but we know big food, the companies that are profiteering on this have always put a debunk and put myth in terms of what this intervention will do. So one of the claims will that they won't work, in as much as there is enough evidence that they have worked elsewhere in countries of the same socioeconomic as South Africa. But I think also there is a low level of literacy and awareness around nutrition. So we're doing this work as an NGO. You'll understand that, and you'll think that this is the kind of intervention that will be scaled up in a massive scale to actually reach more people and to address the problem urgently.
I want to talk about the language use here. When you speak about low levels of literacy about health issues, it's not necessarily only people who are of lower education who don't understand it. Because you and I both know that the people who are driving their kids through the drive-through to get those certain meals that are marketed in a certain way 2 or 3 times a week are not necessarily not educated, but somehow they still don't understand the damage that their actions are having on their children. How do we define somebody who is illiterate about health issues?
Yeah, that's a very critical question, because in as much as me and you are literate, we are not nutrition literate. So the current problem with the marketing, particularly to children, I don't think there's any parent or guardian who intentionally wants not to give what's best for their children. So one of the biggest problems is that when we're thinking we're giving children the treat, in exposing children to ultra-processed food, to unhealthy food, we don't mean that when we start with cereal in the morning, when we give them lunch, when they get to school, this kind of exposure is happening because out of the vigorous marketing and actually the hidden nature of the products, the problematic products in food. So if you look at the front of pack, if you look at the packaging of food currently in South Africa, if you read at the back, there is actually, it's written, for example, sodium 0.5 grams. Sodium is actually salt. We don't call it sodium. So for a person who's actually even literate in a broader sense, but not nutrition literate, they wouldn't understand that. So what we have been calling for as HEALA has been, can we make it easier? For example, like tobacco. The awareness that came with tobacco, for many of us now, we know the risk associated with smoking because of the regulation that came, including the front of pack that shows you, the risk associated with smoking. So when we know, and there's enough evidence with the harms that comes from unhealthy food, it's very important that government, because there are interventions that can help us to, at the first glance, understand the food we're eating. It's both for prevention, but also we must take note that There's no parent, there's no family now that's not living with someone with high blood pressure, diabetes, heart diseases. And those people also, they have to understand and to avoid certain unhealthy food with high content of salt, sugar, and saturated fat. So it's really that's the issue and underlying issue on that.
Nzama, let's talk about the marketing of these meals that have treats in it and that parents find very difficult to say no to when they've got a young child who's adamant about getting that toy that they saw on television or they saw on a magazine or on a YouTube advert when they were watching their favorite show. How can authorities step in there to try and regulate, I don't know if that's a dirty word to use in that space, to try and regulate how these kinds of things are marketed?
Yeah, that's very important. So even including, if you can Google now, on Google, looking for something on internet, what is going to pop up? It's mostly unhealthy products, including unhealthy food. So I think government can do a lot from, from communication perspective and digital communication in terms of what is allowed and what cannot be allowed. If you put regulation in place, for example, we know that long time ago someone would smoke in studio, but because of the regulation now, people who are around people who smoke, they cannot easily get exposed because there's a regulation that enforces that, people cannot do that. The same with food. The marketing of food is very intentional and it's actually targeted at children. If you look at the cartoon, if you look at lifestyle celebrities, children get hooked up. Sometimes if you go with your children to a supermarket, they will want to take a pack that has a cartoon, that has something that is appealing to them. So the manufacturers of the food, they know the psyche of children and how children will yield to a product when they see the packaging of the food.
You sound like you've been listening in on my conversations with my toddler. Nzama, let's talk about cost. I'm privileged enough to be able to sit and complain about the high price of berries. But there are so many more in this country that do not have that privilege. And we now know it's poor diets that are driving these rising rates of type 2 diabetes, hypertension, heart disease, and of course, the effect that the pressure on mental health that people living in poverty have and the impact that that has on their physical health as well. How do we change the perception that to be able to eat healthy does not need to be just an expensive exercise?
Yeah, and we have to give context. That's a very critical question. So two trade-offs. If you want to restrict people from eating unhealthy food or taking unhealthy products, you got to make healthy food accessible, affordable. That's a simple formula. So one of the things that government has been trying to do, but has not been done enough, is the subsidizing of healthy food, some of the staple food, but also understand that we have transitioned from the traditional healthy diets that we used to eat because of this huge marketing and the social status that you have. If you're able to do a drive-through, if you are able to eat in this fast retail restaurant. So I think one of the things that I think it's critical and central here is actually to ensure that make healthier food affordable, right? In a way, don't just restrict people and talk about people not having not to eat unhealthy food, because people eat what is available, what is affordable to them. So, and also government has got big procurement processes that are happening. Look at 8 million children are on the National School Nutrition Program. We can already use like inmates in prison, in hospital. So government can start with, demonstrating that this is doable through like this massive procurement, supply of food that government is actually currently doing. Social protection, food poverty line, kind of social grants, child support grant, looking at, the minimum wage, making sure that we address poverty, and inequality and unemployment. If we don't do all of those kind of intervention, then we'll teach people, eat plenty of vegetables, eat plenty of fruits, but if people can't afford, they will actually eat what is affordable and available.
I have, as a final question, I have a practical question for you. You are leading this national call for front of package warning labels in South Africa. I want to ask you about whether we should be calling for those kinds of labels to go on ready-made meals that we get at fast food places, because at the moment I think the focus is on those labels, on food packages that we go into a grocery store and we buy things off a shelf. So what about warning labels or ingredient labels on those ready-made meals at fast food places? And then also, what about language, the different types of languages that are used on this packaging? How key is that?
Very key. So very critical question we have asked. So the biggest problem with packaged food is that once you have a packaged food in your hand, you can't reduce the amount of the problematic products in it. If that product comes with high amount of salt, you cannot reduce that. Whereas when people prepare meal, they can actually reduce the amount of sugar, of salt, of saturated fat that we're having. Giving a practical example, in 2016, South Africa introduced a salt reduction in bread. So now we're eating bread that has got actually less content of salt. So if you look at the packaged food, one of the things of best practice and practical interventions we can do, if you get to the restaurant, you get given all sorts of salts for free, right? So even if maybe you were not intending to actually put more salt to your food, some people put more salt even before they taste the food, you can actually make sure that, people have to buy those kind of, additional salt that is actually they need to put on the prepared food. So that is doable and something that we wanted to actually implement in Gauteng with the Department of Health here. That this is doable. Restaurant can actually curb giving excessive free sugar, excessive free salt when you're sitting in a restaurant having coffee, when you're sitting in a restaurant eating a prepared meal.
Fantastic. I'm going to leave it there. Fascinating discussion. Let's have more of it. Nzama Mbalati is the CEO of the Healthy Living Alliance, joining us virtually from Johannesburg. Lots of work to be done in that sector. We'll have more for you here on Newsnight. Don't go anywhere.